On this program, as I said last night, we'll be talking to people who simply know their stuff. And amongst the best is, yes, she's here, Peta Credlin, and she joins me from Melbourne. Peta, good evening.
Good evening, Mr Jones. Welcome back to Sky.
Thank you so much. Lovely to have you on board as well. Well, from your perspective, what the hell is going on? I mean, you know the business about politics. This bloke talked tough, acted tough and thought, hey, if we do this, I'm going to be a hero again and I'm right for the election. He played the political game and it's now blown up in his face.
Look, it absolutely has. I've never seen a Premier with more rat cunning than Daniel Andrews, but there's no follow-through, there's no delivery. It's like he's made some deal with the public service and officials down here in Victoria. You keep out of my way and I'll let you do whatever you like. And clearly, there's been no one with an eye on detail in his office, in the Premier's office, following through the implementation. I think that there is a grubby secret that will emerge about how they made the decision not to involve the police. I have been told the police union did not want to babysit, as they say, the returning passengers. So then there was the outsourced players, the private contractors who came in. That's where the risk happened. Victoria, like everywhere else, had suppressed coronavirus to very manageable levels, but then they had this incoming risk every time passengers came in if they were not looked after properly in quarantine. That's where the thing escaped, Alan.
Right.
And all over again, you talk about cedar meats, you're absolutely right. You've got a breakdown. It's called systemic, which means it's a breakdown of the system. It's systemic failure across every level in Victoria. And Brett Sutton, you talk about these unelected bureaucrat health managers, he's the Chief Medical Officer in Victoria. Back in May, in a national medical journal, he writes this huge paper, and it was a substantial paper, would have taken a bit of time, about hospitals and climate change. So you can find the time to do that in May, at the time the quarantine system was breaking down. It beggars belief.
Yeah, just to explain what Peter is saying there, she's explained it brilliantly, but in terms of the breakdown, Andrews put the private sector, security guards, and you know security guards are everywhere, they've got no training for this very sophisticated and complicated job of managing quarantine. And as a result, there were significant security breaches, and as a result of all of that, those people allegedly in quarantine were, in fact, spreading the virus. You've got then this health minister who has said, it's unbelievable, this lady, she said, oh, well, there are 10,000 people who refused to be tested. What did you do about it? Nothing. I mean,
no, there's no consequences. That's the deputy health minister here, Chief Health Officer, the deputy in Victoria. She's the one who doesn't know a Captain Cook from Arthur Phillip. That's the same one you're talking about there, Van Diemen. You're absolutely right. There was no consequences for failure to test.
No.
I drove around Melbourne in the suburbs on the weekend. I went in and out of these COVID suburbs where they were in the hotspot lockdown, 36 suburbs. I then went to the Housing Commission flats, which are on the edge of Melbourne as people come off the Tullamarine Freeway. They know coming into where the Royal Children's is. That's how close we are talking to the CBD. And as of tomorrow night, the entire CBD, all the way through down to the Mornington Peninsula, 5 million Melburnians are locked down. Because of what? Because of an incompetent government.
No